Hello, myself Dr. Viral Patel. I am MBBS DCH and I have done fellowship in neonatology from National Neonatology Forum of India. I have been practicing along with my partner Dr. Pritesh Patel since 4 years in Navsari, Gujarat. We basically deal with pediatric and neonatal OPD and high-risk counseling for the high-risk pregnancy, and our main focus is neonatal intensive care. Recently, we have introduced neonatal imaging package in our practice by Agfa. Having neonatal imaging package as in-house X-ray facility helps us to diagnose the disease pathology right away, helps us to formulate the ventilatory strategy, and even review it afterwards. With wireless Duraline X-ray detector, we can get the images on PC within 3 seconds, and it helps us to view and manipulate it right away. Once we have identified the disease, the next step is to decide whether to ventilate the baby invasively or non-invasively. Once it is done, it is important to review your strategy within 4 to 6 hours whether it is working or not. This becomes very convenient with the neonatal imaging package solution from Agfa.
Upon the admission of the baby, it is very important to identify the disease what we are dealing with, whether it is congenital comorbidities like tracheostomy, fistula, pulmonary dysplasia, pulmonary airway malformation, CKM, or persistent pulmonary hypertension, or acquired conditions after the birth like transient tachypnea of newborn, meconium aspiration syndrome, pneumothorax, or bronchopulmonary dysplasia. X-ray will clearly identify the disease what we are dealing with.
While ventilating the baby, we can encounter some complications like pneumothorax or worsening of the disease, which can lead to acute deterioration of the child. In such cases, having in-house X-ray, which can give you real-time scenario within 3 seconds, also helps us to save baby's life in such emergency cases. Image quality is very crucial to the neonates, as the whiteout lungs used to confuse us whether respiratory distress syndrome is whether it is grade 3 or grade 4, which gets very clear with the use of Musica software with 124 micron detector, which helps us not only to identify and visualize the lungs properly, but it also reduces the multiple retakes and overall dosage to the baby.
Balancing the dose of ionizing radiations is one of the most priority of modern imaging diagnostic. One of the special addition in a neonatal imaging package is the dose monitoring tools, which help us to communicate the safety provided at our hospital to the babies, which assure parents and reduce their worries of excess X-ray radiations to the patients.
Neonatal imaging package comes with some great features like catheter processing software, which helps us in day-to-day NICU procedures. For example, central lines, umbilical lines, and PICC lines. Position of the catheter is very important because it can lead to some complications. In such cases, the length adjustment is only possible against the X-ray reference. Here, with just one click, we get the position of the catheter without multiple exposures. This helps us to avoid complications which can occur due to malpositioning of the catheter, like cardiac arrhythmias and thrombotic events. My overall experience with neonatal imaging package from Agfa has been really good. It is on point, user-friendly, and very convenient. It has helped us not only to save the child, it has helped us the intact survival of the child.
X-ray is important diagnostic tool in diagnosing and monitoring a spectrum of diseases. We are highly satisfied with digital and mobile access system. It is important for compliance with care and continuity of newborn care. With neonatal imaging package, overall X-ray cycle time has reduced to 3 seconds. Because of this, our productivity has gone up. Hence, we are able to diagnose much faster and more accurately.